Well, when we think about our health and well-being, we often think about our physical health, things like cholesterol and blood pressure. But how many of us also think about things like housing, transportation? They are among the social drivers of health that have a direct connection to our overall health and well-being, even our life expectancy. So to talk about that and resources available through Cone Health to improve access and health outcomes is Dr. Olu Jegede, the Chief Health Equity and Community Impact Officer at Cone Health. Thank you, sir, for joining us this afternoon.
Thank you for having me.
Well, let's start here. For those who may not be familiar with the term social drivers of health, explain what's included and the impact they have on a person's health.
Thank you. So when we talk about health, many people think about lab results, they talk about vital signs or what happens at the doctor's office, really. But the truth is, our zip code can be just as important as as our genetic code. So social drivers of health are the conditions in which we are born, in which we live, learn, love, work, and age. That include things like housing stability, transportation access, education, income, and even access to healthy food. And, unfortunately, these social drivers constitute about 80% of what is health outcome. Clinical work or what happens in the healthcare setting is only about 20%. So 80% is huge, and that is why it is so important that we also solve for social drivers of health because that is now taking care of the whole person, not just the disease or the chronic conditions that bring them to us in the first place.
And looking at areas where we live and work, how have you seen those factors impact our own community's health? Just kind of like what you were saying.
Yeah, so at Cone Health, we believe that your street address should not determine your health, should not determine how long you live. But too often in this area, it is. In Guilford County beyond, for example, we see stark health differences just a few miles apart. Like we talk about life expectancy, there is about 15 years gap in life expectancy between one part of the city and the other. And what account for this is some of this neighborhood may have easy access to parks, grocery stores, and doctors' offices, while another has aging housing, limited transportation, and even long drives to healthcare when it is available. So these differences lead to kind of lower life expectancy. It leads to very high disease burden. Sometimes these chronic illnesses go uncontrolled, like high blood pressure, high blood sugar, cholesterol, those that impact life negatively, and even few opportunities of thriving. We need our communities to give us that opportunity to thrive. And that is what we talk when we say health equity. How do we define that? Giving everyone the fair and just opportunity to be as healthy as possible.
Yeah, absolutely. And for those who are impacted by these social drivers, finding resources to remove those barriers can definitely be challenging. But we know that Cone Health has made it a priority and has several resources available that people can access. So let's talk about some of those resources.
Yeah, so we have what we call Find Help now. It's a free, easy to use online tool that connects everyone with all the resources in your own local community. It is very easy to use, and when you just put in your zip code, it connects you to things like food pantries, like housing support, job training, transportation, and even more. I consider Find Help as a GPS for hope. GPS for Hope is like when you put in your zip code, it shows you where to go when you need support. You
Yeah.
simply just, yeah, that is as simple as that.
And Dr. Jegede, anyone can access Find Help as well too. And where can they
Ab-
find it?
Absolutely. Find Help is free and available to everyone. You don't need insurance, you don't need login. Just visit conehealth.com/find help. Whether you are looking for food, shelter, childcare, or legal help, it's all there in one place and it is available 24/7.
Absolutely. And my last question before we go to break, you guys also have some free events coming up that will provide an opportunity for people to access resources in person. Can you talk about some of those events? How soon is the most upcoming one?
Thank you. Yeah, we are very excited about this. Building Better You event. This is the third one in Guilford County, in Greensboro specifically. It is going to be on August 2nd in the Coliseum. And the other one is on September 27th in Rockingham County. And this event we offer free screening, primary care connections, and on-site support for services such as those social drivers that we just talked about, food assistance, housing, job training, and it is just a one-stop shop for all our community members who need this assistance.
Wonderful. Absolutely. Thank you so much. Well, we're going to pause this conversation right now and continue after the break.
Thank you.